One patient came to me, doctor. He's saying that you are my 15th doctor. I went to Florida, California, best doctor around the states, and then lower my pain only 10%. I said, yes, not 10%. I can lower your pain 60% in 3 days. Without painkiller, no steroid, nothing. Body will naturally lower the pain. And she have a extreme pain on back and joints and unbelievable. He's not rheumatoid arthritis patient. And the point, what I did, those patients and some other patients, what I saw is mostly acidic body, low immune system. And so acidic body is a key for the pain. A lot of time joint pain would improve when improve the absorption of protein. Of course, fatty acid omega is important too. So if we maintain them, all of them, you won't have a joint pain because your body is going to be alkaline. Your tissue is going to be alkaline. Your body will be absorbing the nutrient. You'll have enough cartilage, enough bone marrow, then you'll have strong bone.
Well, I'm Dr. Noel Boaz. I'm an MD, PhD, and I specialize in human clinical anatomy and evolutionary medicine. I'm very pleased today to have a discussion with Dr. Haque about his approach to dealing with integrative medicine and dealing with the whole patient. We have a few topics today that I think quite timely in looking at issues that patients around the country and in fact around the world are dealing with.
Correct.
Dr. Haque, it's a pleasure to be with you today.
It's so wonderful, Dr. Boaz, meeting virtually, and we're going to discuss such important topics. And it's so happy and it's a pleasure to speak with you today.
It's a pleasure to be here. Now, I have a number of topics that you've sort of indicated are of great interest to your patients, and then we sort of well, I had the next topic on the list, I think, which is of concern, is back pain and joint pain in patients. Also, a very, very common complaint, isn't it? Pain in the back, and we could think, well, that's interesting because is this a new thing, or like obesity, or is it a very old problem? Have we had this for generations, or is it something that's really becoming much more common? It sort of seems to a lot of practitioners that back pain, joint pain is becoming more of a problem than it used to be.
Right.
What's your experience?
Dr. Boaz, what I saw, patients always come with a painkiller or turmeric, supplement for the pain. And they've been going to chiropractor. The patient comes with a lot of pain that, okay, we've been doing, this therapy, heat therapy, and they get help temporarily, but ended up the pain comes back. Back pain is very common, sciatica pain, back pain, and joint pain. So I mean, a lot of time knee pain. Interestingly, as a doctor, that you doing the medical research as well. One patient came to me, doctor. He's saying that you are my 15th doctor. I went to Florida, California, best doctor around the states, and then lower my pain only 10%. I said, yes, not 10%. I can lower your pain 60% in 3 days. Without painkiller, no steroid, nothing. Body will naturally lower the pain. And she have a extreme pain on back and joints and unbelievable. He's not rheumatoid arthritis patient. Pain coming from all. She had some history of disease like Lyme disease and stuff. But the point, what I did, those patients and some other patients, what I saw is mostly acidic body, low immune system. When low immune system is underworking, opportunist pathogens, bacteria, viruses can grow, and they make a lot of toxin, and toxin goes to the joints and everywhere of the body, leaking our gut. So when it comes to acidic body, it's a lot of things involved, not only infection, not only bacteria, not only pathogens. It comes with a lack of magnesium, lack of calcium, lack of all the metals. When it comes to acidic body, it comes with a stress too. The stress makes body in a sympathetic tone, fight and flight mode. That's what makes body acidic too. And so acidic body is a key for the pain. So could be mineral, could be lack of good gut flora. It could be omega-3 omega deficient. When you have a omega-3 to omega-6 deficit ratio is low, and that is a causing issue too, because that makes inflammation in the joints. Also, a lot of people doesn't have enough gut acid level good. When you don't have our stomach need strong acid to digest the food. If pH go 3, then bodies stop absorbing the protein. And sadly, people focusing on only take protein shake, take this for protein, this for protein. People don't focus on the how we can improve the absorption of protein. Then you a lot of time joint pain would improve when improve the absorption of protein. Of course, fatty acid omega is important too. A lot of people doesn't have a strong gallbladder to digest the fat into fatty acid. So improving fatty acid quality, omega-3 over omega-6 ratio, and absorbing the protein, improving the protein absorption, balancing the body mineral, especially magnesium and others as well. And then good gut flora, good profile of gut flora, good spectrum of gut flora that will help not to grow opportunist pathogens. So if we maintain them, all of them, you won't have a joint pain because your body is going to be alkaline. Your tissue is going to be alkaline. Your body will be absorbing the nutrient. You won't have a missing of cartilage. You'll have enough cartilage, enough bone marrow. Then you'll have strong bone because bone need good magnesium to absorb calcium. And I saw a lot of people focusing on the calcium. Yeah, calcium needed for many purposes for the tissue, but people focusing more calcium on the joint. Because if magnesium is right, calcium will follow along. But if only calcium, that is going to cause even other disease. So it's all about, doctor, what I've seen in my practice in my patients. I just focus on make body into alkaline. I give them coconut oil, so it's a medium chain fatty acid. It helps body lower the inflammation. And a lot of people, and improved digestion is a key factor too. If they improve digestion, they will have a good elimination. They will have a good bowel movement. That's extremely important because our larger intestine is the one absorbing the minerals. If you have a constipation, you don't absorb the mineral. You will be deficient of mineral, no matter how many mineral pill you take, or it's not gonna work. So, doctor, that's what I see, even hormone imbalance. So a lot of patients are, especially female patients, are deficient of progesterone or high testosterone or high estrogen. That causing also mineral absorption issue, and that causes bone weak, bone become not regenerating bone properly, and joint bone marrow issue all comes together. And in that case, one thing is fatty liver is a big problem too. If liver is fat, that causing long run joint pain too. So in summary, doctor, in my practice, I saw improve the digestion, get a plant-based diet, do everything to make body good alkaline system, and improve the gut acidity. Acid level is good, so digest good, and improve the liver function. Finally, mineral, balancing mineral, and balancing mineral will help absorb the water, because body cell and joints will not have enough water until have enough mineral in the body. So if you can maintain all of them, you won't have a joint problem. But temporarily, someone have a joint problem. I give anti-inflammatory proteolytic enzyme. I give them natural turmeric mixed anti-inflammatory herbs and stuff. Of course we do, but we have to look at the root where it coming from. Then solution is easy, right, doctor?
Yeah, well, that's a very interesting perspective. I mean, you have a very broad-based endocrinological and nutritional perspective, and I think that's very important. I was just going to mention too, from a standpoint of situations which, for example, gout. That's a very specific aspect that we know also we can apply uric acid in the joints, and it has a specific nutritional component to it. Back pain, though, specifically, may well also be based on again this increase in sedentism. You know, people sitting in one place, they don't have the normal activity that along with the nutrition and the minerals and everything. I think that's another thing that can tie into specifically why the back is a problem, because you know, we stand upright, and when we stand upright, weight tends to our muscles that are in our backs are the anti-gravity muscles, and so we're sort of designed to be active animals, and along with all of that, it's a complex system, isn't it? I mean, when we
Yes.
talk about physiology, which you're talking about, it all ties together. But the approach of the whole individual is what I think you're saying, and I think that's the important message here.
Yes, doctor. Thank you.